So we are live and streaming on Facebook and starting to get our attendees with us. And so welcome everyone today to our webinar this afternoon, I guess, is just recently turned to the time on how to access healthcare coverage services for your congregations, for your community members, or your family members. We are so very honored here at Arizona Faith Network to be joined today by Alan Gjersvig, who is the Director of Outreach and Enrollment Services at the Arizona Alliance for Community Health Centers, and Zaida Dedolph, I'm not saying that right, Zaida, I apologize, Director of Health Policy at Children's Action Alliance. I'm Reverend Katie Sexton Wood, and I am the Executive Director of the Arizona Faith Network. And always, we are here as a network to be resourcing our faith communities across the state with all of the things we can to help you help your communities, not only in your house of worship, but those around you. And so with that, I'm going to turn the microphone over to Alan to kick us off today. Oh, and
actually, Zaida is going to go first.
Just a quick housekeeping note to Zaida before you correct me on how to pronounce your name correctly. If you have any questions during this time together, please lift it up in the chat or in the Q&A, and I'll be looking for those. Or if you're with us on Facebook or YouTube, lift those up in the comments, and I'll be watching for those as well. Zaida.
Awesome. Thank you so much for having us. We're really excited. My name is Zaida Dedolph. I'm the Director of Health Policy at Children's Action Alliance, and I'm excited to talk to you a little bit about the importance of health insurance, and then Alan will kind of cover what faith leaders can do to help get people enrolled. Would you mind advancing, Alan?
Yep, just one. There we go.
So Arizona has a higher than usual rate of uninsured children. We did see some really significant progress made after the passage of the Affordable Care Act and some of the resources that it provided with regards to health insurance. But over the past 4 years, we've seen things heading in the wrong direction, both nationally and in our state. In 2019, Arizona ranked 48th out of 50 states in the District of Columbia for our rate of children's health insurance coverage. Next slide, please. There it is. And I really wanted to just kind of demonstrate some of the disparity that we see between different races and ethnicities when it comes to uninsured kids in particular. What that 9.2% is all Arizona kids averaged together, lumped into one pile. But when we look at that and we look at the rate of uninsured American Indian, Alaska Native kids, it's significantly higher, and this is actually back up to pre-ACA levels. About 1 in 4 American Indian children in Arizona is uninsured or was uninsured as of 2019. And I'll kind of pause there and say that we would anticipate that due to some of the economic stressors, and we know a pretty significant job loss, income loss over throughout the pandemic, that number would actually be significantly higher across the board. We just won't have a very accurate way of measuring that until the end of this year. I wanted to also just, it's fine, Alan, you can move ahead, but I wanted to call attention to 2 other racial and ethnic groups that we see pretty significant disparities in, one of which is Hispanic Latino children in our state. And you can see kind of this difference here. When we look at census data, it gets a little bit tricky because of how people self-describe. And so we might actually see that the rate of Latino children is even higher than 10.8%. But this is one of the faster growing rates for children who are uninsured. And then I also wanted to just highlight that among Asian and Pacific Islander children, as well as Native Hawaiian, kids in Arizona in particular, the rate more than doubled between 2018 and 2019. So this is a group that we really need to be investing in and looking at the reasons why that's happening. Next slide, please. So we're here today to primarily talk about Medicaid and CHIP coverage, but all of the resources that we share are also available to help out with Marketplace enrollment as well. So when we talk about Medicaid and CHIP, I like to just kind of level set and make sure everyone's on the same page about what we're talking about. I know that these terms get thrown around a lot. So Medicaid is a health insurance program. It's a partnership between federal and state government. And every state has a Medicaid program. Arizona's is called the Arizona Healthcare Cost Containment System, or AHCCCS. And both children and adults who meet certain income and residency requirements can qualify for Medicaid. So I'll be talking a little bit about the residency requirements. I'm sure that Alan also will. He'll be focusing as well on some of the income parameters around those programs. And then CHIP is the Children's Health Insurance Program. So that covers children who meet, again, specific income requirements and residency requirements. In Arizona, our CHIP program is called KidsCare. And again, this is a partnership between the federal and state government, with the federal government picking up most of the tab and the state contributing a much smaller amount of funding. And then Medicare covers adults who are 65 and older, as well as some younger people who have certain diseases or disabilities. So we do have children who are enrolled in Medicare. It's much less common, but it does happen. And that's completely federal. The state doesn't put in $1 for Medicare. This is really the bulk of what I want to talk about today, and I'm grateful that everyone could be on this call. But when we talk about Medicaid and CHIP coverage, it's about more than making sure that families can access affordable health care, right? It's about so many more things than that. And I really want to stress that the generational impact that having health coverage has, regardless of the source of it. And so particularly with Medicaid and CHIP programs, there's been some really amazing kind of longitudinal research that's been done that demonstrates that kids who are covered by Medicaid or CHIP for any period of time during their childhood see lower rates of chronic illness and disability in adulthood. And that because they're able to graduate from high school, attend school, they're not staying home sick with chronic illnesses that are going untreated due to cost. They're not staying home to watch younger siblings who might be ill and having to stay home from school so parents can work. We see higher high school graduation rates, more on-time graduation, and greater involvement in post-secondary education. That in turn contributes to all kinds of other things. Particularly when we look at children and adolescents who are covered into their teenage years, we see them have higher earnings as adults. And the tax differential, I guess you could say, between adults who had Medicaid as children and adults who did not, really it pays for itself by the time that child turns 36 in higher tax payments, stronger revenue, etc. So it's really an investment that pays for itself in a very short period. We see adults and children who have Medicaid coverage be hospitalized with less frequency and have to go to the emergency room less frequently. And we see reduced mortality in early adulthood from all causes, but in particular from cancer, infectious disease, and nervous system diseases. And then one of the things that I wanted to kind of, just point out is that all of this translates into increased economic mobility. So this is an investment in not just health equity, but really in economic equity, and in making sure that we're setting people up in childhood to succeed in adulthood. And then just lastly, one last thing I wanted to point out is that when children have had Medicaid coverage for any period at all, their infants actually, in particular, birthing people's infants have a healthier birth weight into the next generation. And so this is something that really does, we see this generational ripples. Next slide, please. Awesome. Alan, could you go back one? Thank you. And so there's a lot of questions and concerns right now. I think that I was out speaking to your steering committee, gosh, it was a couple of years ago now, about public charge and the impact that that has had on enrollment in all of our supportive services, all of our safety net programs. But I did want to stress that that many people who might not realize it are eligible for Medicaid or CHIP. They do have to meet certain eligibility criteria in Arizona, though other states have extended Medicaid coverage paid by state funds only to any immigrant, any person living in that state. And so generally people are eligible if they're a resident of the state of Arizona, if they have or if they've applied for a social security number, if they're a US citizen or a qualified immigrant who has lived in the US for at least 5 years. There are some groups that don't have to meet that 5-year threshold. So refugees, for example, qualify immediately, and a few other types of kind of humanitarian immigration statuses may also qualify immediately. They do have to meet income eligibility requirements, which Alan will go into greater detail about. But I also wanted to just stress that if there is a life-threatening emergency, if somebody has a reason to believe that they're gravely ill or gravely injured, anyone can get their care covered at a hospital if it's deemed eligible for emergency services through a program called Emergency Medicaid. So this is a situation where, say I'm an immigrant, I am not documented, and I have a car accident. It doesn't always get mentioned, but that person should absolutely seek care. They should absolutely go to the hospital and get the care that they need when they need it. And that the potential exists to ask about emergency Medicaid coverage for that illness or injury. Next slide, please. One more note on that topic, and you don't have to go back, Ellen. Thank you. But during the state of emergency, I also just wanted to stress that vaccines are eligible to anybody. Anybody is eligible for the COVID vaccine and for testing. And there are other resources available for COVID treatment for folks who might not qualify for Medicaid otherwise. So it shouldn't serve as a deterrent to seeking testing, treatment, or vaccination for COVID. So KidsCare is a little bit different. KidsCare is available to kids who live in households that earn slightly more than the Medicaid population. Again, the child has to be an Arizona resident. The child has to have or have applied for a social security number, or the child has to have a qualifying immigration status. And the big difference here is that families do pay a monthly premium for KidsCare. It's a sliding scale based on income, but it will never be more than $50 for one child or $70 for one or more children, or for, I guess, 2 or more children is how you would phrase that. Importantly, premiums are waived during the pandemic. Nobody owes anything. You can't be disenrolled right now for failure to pay. And members of American Indian tribal nations, their children and their grandchildren do not have to pay a premium. And I want to just add one kind of asterisk here, that there are also many types of tribal income that do not count towards somebody's KidsCare application. So for example, if you're an artisan who is a tribal member and you make most of your income selling arts and crafts that are culturally rooted, then that income that comes from the sale of those goods would not count towards your income for purposes of KidsCare. So it can be a little squishy there, it can be a little hard to describe, but I do think that's a really important point to bring up. Next slide, please. Sure, thanks.
Thank you so much, Zaida, and thank you for the opportunity to address all of you. And I'm going to get a little bit more detailed, and we're both going to be available for question and answers afterwards. So I know that during this pandemic, more people are knocking on the doors of houses of worship, asking for basic need help. I also know that houses of worship that have members, the faith leaders are seeing more members coming in describing very difficult situations and the fact that they need help. So what we're trying to do today is give you some resources that will be available to you so you can make a better referral, so you can help people in need. We're not trying to make you experts, but we are trying to tell you where you can find help. So to continue, isn't it funny, if I move my mouse, then I can't advance the slides in this one way. Come on, let's try that again. There we go. Zaida's mentioned Medicaid or Access, KidsCare, and Marketplace. Both Medicaid and KidsCare are essentially public funded programs, whether it be state or federal. The big confusion about the Marketplace is it's also called Obamacare. It's also called the ACA for the Affordable Care Act. And many people still today do not understand and believe that the insurance from the Marketplace is from private insurance companies. Names like Cigna, Blue Cross Blue Shield, United Healthcare, and others provide the insurance. The public, or in this case, federal part, is to provide some financial assistance. So all three of these programs have one thing in common, and that is that the key to understanding them goes back to income and family size. So to give you a little bit of look behind the curtain, we talk about FPL, which stands for federal poverty level. Access goes to 138% of federal poverty level. So if you were a family of three, in the yellow highlight, you could see you could earn nearly $30,000 a year, and all three members of the family could be covered with Access. If the income falls between 138% and 250%, you could shop in the Marketplace and you would receive very generous financial help. I'll go into a little bit more details in the next slide. And that financial help in the Marketplace continues for a family of three to nearly $87,000 a year. And what is hard for people to grasp, and research has proven this, is that most people who remain uninsured simply believe they can't afford it, even though we know that there are hundreds of thousands of people in Arizona that could get no cost coverage or very low cost coverage today if they would simply try. So here's another way to look at it. Again, my same family of four. Just wanted to point out that, again, 138% of poverty level for Access, 200% of federal poverty level for KidsCare. When you get to the health insurance Marketplace, there are two kinds of financial assistance. If you earn less than 250%, you get cost sharing reduction, CSR. So that means you pay less when you see a medical provider. You also receive premium tax credits or advanced premium tax credits. The important thing to remember there is tax credits help to lower your monthly premium. So some people in this category of under 250% literally qualify for a free plan because the tax credit covers 100% of their monthly premium. Now, once you cross the 250% mark, then you only receive the help that reduces your monthly premium. You do not get help to reduce your out-of-pocket expenses. The reason I'm sharing this is simply so you understand that there is really a continuum of options to help uninsured families and people that go from very low incomes well into the middle class. So here's the important stuff. How can you get help? So whether someone's knocking at your house of worship's door or it's a member that you are counseling, I want you to know that we have licensed and certified helpers. These are not salespeople, and they work at nonprofit organizations. Some of them are called Navigators, some of them are called certified application counselors, and you can reach them all across the state with one single phone number listed there through our Cover Arizona Coalition. You can also go online to coveraz.org and actually make an appointment to see one of these assisters. And the statewide 211 system also has information how to connect with these helpers. I wanted to point out that all of these helpers can also help people sign up for Supplemental Nutrition Assistance Program, formerly food stamps, now called SNAP. So if you have people that are looking for cash to get a meal, there's a good chance that they would also be eligible for access, that they would also be eligible for SNAP. And the helpers that we have available across the state are bilingual. Some of our helpers speak Asian languages, but we all have access to 54 different languages. So if you have members that are immigrants and speak other than Spanish or English, we can still help. So, same goes with the Marketplace. We have these licensed and certified helpers that can help people navigate. I wanted to point out on this slide, though, is that the Marketplace is normally only open from November 1st to December 15th. And when it's closed, you cannot buy, shop, or enroll unless you have a life-changing reasons: birth, death, move to a new county, loss of coverage. Those are the kind of things that are life-changing that can trigger a special enrollment period. But due to the pandemic, the current administration has reopened the Marketplace. It's open right now and will continue open until May 15th. So that means if you're uninsured, you can go to the Marketplace today. You do not have to have a reason. You do not have to prove that somehow you're uninsured because of COVID. It's simply open. No matter what other people call it, it is now open and available to you until the 15th of May. I just wanted to also emphasize what Zaida said. To qualify for access or KidsCare, you must be a U.S. citizen or a legal permanent resident, but you have to have 5 years of that green card or legal permanent resident status to qualify, except for emergency access. And we had a friend who unfortunately is not documented, had a terrible accident, and he qualified for emergency access because it was a life-threatening event. Same with the health insurance Marketplace, but a few changes. You must be a citizen or a legal resident, and the categories of legal resident are much wider than for Medicaid, and you do not have a 5-year waiting period. So really it comes down to if you are present in the United States living here and you're legally present, even if it's temporary, you will most likely be able to shop in the Marketplace. Some people like to do it yourself, DIY. You can go to Healthy Arizona Plus and enroll in Access, KidsCare, or SNAP on your own. I will tell you that people that try it on their own are successful about 50% of the time, where people that seek help from one of our sisters are going to be successful more like 90% of the time. So it is not terribly difficult, but there are some very confusing questions, and sometimes you have to provide proof of residency or proof of income. The health insurance marketplace, you can do it on your own in Spanish or English, and you can call or go directly online. One of the things I forgot to mention is that all of our helpers or assisters at this time are doing virtual appointments, and many of them are also now doing face-to-face. So a person that tries to reach out and get help does not have to live in a particular area that's close to one of these helpers. We can help across the state, multiple languages, and we can do it by phone or a virtual link, and we can make arrangements to hand off documents if they're needed. I don't want to forget that some of you may get questions about Medicare. And with Medicare, it is not income-based, it's age or disability-based. So it's not driven by income. I am age-based, and I am on Medicare. But I wanted to let you know that there are non-salespeople, volunteers that are highly trained, that are helpers in the Medicaid area. And you can reach them through the Arizona State Health Insurance Program. A friend of mine runs that program for Arizona. So give them a call and they will get back to you and help you with questions regarding Medicare. So last of all, well, second to the last of all, low-cost health care providers. I work with the Arizona Alliance for Community Health Centers. We represent about 20 to 21 federally qualified health centers, but they have 180 locations. They each provide comprehensive primary care, pharmacy, dental, behavioral health. Some of them have laboratories and radiology inside their facilities. They accept insurance, but they also offer a sliding scale based on income. They can become a medical home, just as any private primary care. And you can find locations all over the state at that URL, and the slides are going to be made available to you. There are also, particularly in the greater Phoenix area, a number of free clinics, and there are some in major cities like Tucson, Yuma, and Flagstaff. Free clinics are not regulated in any group sense. They're regulated as providers. So some of them may charge a small flat fee. Some of them may charge nothing. Some of them may ask for a donation. The services they offer vary widely. Some may only specialize in women's health. Some have broad services, including dental. In most cases, they do not accept insurance. But again, there are some exceptions, and they may take access. They don't really serve as a medical home. There's much more for that, for care where people cannot afford any other option or are in a temporary situation. And we may even have some people on the phone associated with Neighborhood Christian Clinic, St. Vincent de Paul, Mission of Mercy. Mission of Mercy sets up their clinic inside faith-based organizations at different locations in the valley. And there are others, I just couldn't list all of them. The point being is there is help for everybody. And everybody in Arizona usually means even people that lack documentation. There is some form of help. And federally qualified community health centers are required to help anybody, no questions asked about their documentation status. So what I've told you is all true. In another couple of weeks, some of what I'm telling you will no longer be true, but we don't know the details. In the very large COVID relief package that I believe the House is debating today, the President will sign, there are funds available to expand financial assistance for the marketplace. Thousands of Arizonans will now qualify when this happens for no premium coverage in the marketplace. The details we're not going to go into because they're still somewhat in flux. Everything's not been worked out. But the point is that some people that have marketplace coverage today may be able to get a much better deal in a couple of weeks, where now they're paying something for their monthly premium that may go down to zero. One of the big criticisms of the Affordable Care Act is that it doesn't provide enough help for people that earn more than 400% of federal poverty level. And the fact is that once this bill passes, once this bill is signed, there will be reductions in the premiums that people have to pay even if they're over 400%. And how that impacts an individual depends on age and their income. Last of all, if a person has joined COBRA, in other words, you had insurance at your work and they were a large enough employer that they're continuing your coverage and you share the cost, that it's very expensive, the premiums that you would have to pay are going to be reduced to zero. So this is just to point out that the world that Zaida and I work in changes frequently. And with that, I just want to say thank you again. Happy to answer any questions. I see that we're at time. And if you didn't get our email address, I'm sure that Reverend Katie can send it out. But we're here as long as Katie wants to leave the line open. Thank you.
Thank you so much, Alan and Zaida. We will send out the recording link of this along with the slides after we sign off. But while we are still here, and I know some of you might be on your lunch break and need to run, we just want to answer any questions you might have if there are any. I'm not seeing any right now, so they might need to go back and watch it again like I do. And we definitely will provide emails for our presenters today so you can follow up with them. So I want to thank you both so much for your time. We will be sending this resource out, and if you are watching this presentation after the live recording and have questions, please don't hesitate to reach out. We absolutely want to get those answered for you at any point. We'll provide this on our website for an ongoing resource you can share with houses of worship or whoever you think needs to hear it. We are very grateful for your expertise today, and very exciting to see the House doing some good work today and helping get some relief out. All right, with that, we're going to say goodbye and have a blessed day, everybody.